Hello, ladies and gentlemen, and welcome to Fluxx Talks. I have with me a very versatile, dynamic healthcare expert, I must say. Well, ladies and gentlemen, he is changing the healthcare landscape. I have with me Dr. Saleh Alkhunein. Dr. Saleh Alkhunein is a director, medical practice control department, Prince Sultan Military Medical City. Dr. Saleh, we welcome you to Fluxx Talks.
Thank you so much for having me actually in this wonderful gathering of experts worldwide in different industries. I'm really happy to be here just to exchange my knowledge and also to adapt knowledge from other sectors, including actually the healthcare.
Definitely. And we're looking forward for such an inspiring and very insightful conversation with you, Dr. Saleh.
Thank you.
Dr. Saleh, now I have a very pertinent question to start with. Can you share your journey into healthcare leadership and how your experience have shaped your approach to leading complex healthcare systems?
Okay, it is actually a very complicated question, but I can brief it. Let me say for you that leadership in healthcare is very complex. Uh, uh, Complexity came that it should have a combination of wonderful, deep clinical experience. It should have an operation experience also, responsibility, and it should have actually knowledge of system level challenges. All of these combination of these things should happen all together, and that's why I'm saying that clinician experience in clinical practice never happen alone to be a leader. Experience in business administration is never happen actually to be a professional leader in healthcare leadership. That's why actually leading health care system, the complex health care system, it came from capability of system thinking for system integrity and actually from the multidisciplinary intersection. And that's why it required at the end to have an excellent outpatient care, high quality care that the leader should have to integrated all of these pathways all together. So it's not actually a solo decision. It's gathering of everything that to have shaped common shaped purpose, and it should have quality capability. It should have actually capability of balanced what I can say decisions, and the leading in healthcare would not be actually come through by hierarchy, but by influence.
So, as we talked about healthcare, so now there is artificial intelligence, there are data transformation happening in the field of healthcare. So, how is data science transforming decision making in healthcare? And what opportunities does it create for improving patient outcomes and system efficiency?
Okay, let me just tell you about the how to be a professional in data science
Yeah.
and artificial intelligence, and the same time to be a professional leadership. Myself, when it came that being purely clinician, having a subspecialty in neuroanesthesia, neurocritical care, I prepared myself in different benchmark universities like Michigan University, Virginia University, California Institute of Technology, MIT, and Imperial College of Business. I got master in business administration. I got master of science in healthcare management and doctorate in business management. So answering your question, recruiting all of these things of the artificial intelligence and data science in general. It will make actually and do the healthcare leadership faster. It will do it actually accurate, and the most important thing that it will make it more predictive. So leading through actually predictive decision rather than or proactive decision rather than reactive decision. So recruiting all of these things actually is happening through, we recruited in the beginning, it came in more in quality. We recruit it in resources allocation. We do it actually to lower the waste in the system, and also to the cost pressure, which is one of the most important things that leaders they are looking for, and also the something we call it value based care rather than care itself. Yeah. And actually what is called actually the combination of all of these things all together. So that's why it is very important on the operational level, on the clinical level, and on the quality level.
Definitely. And as they say that, as you also mentioned, that artificial intelligence data transformation in healthcare can make healthcare more productive and more preventive.
Yes.
Well, now, in your view, what are the essential leadership skills that clinicians need to develop in today's data driven healthcare environment?
Yes. The leadership in healthcare management, or leadership than more than the management, they will need actually advanced clinical leadership preparation. So I cannot bring a clinician purely and put him in leadership. He should have actually, there should be a preparation in clinical leadership. They should have digital fluency, and they should have the system capabilities. All of these blend will give them some skills in data fluency, and also in critical appraisal, and also in system thinking. Not only that, but also for the change and transformation management. Not only that, but also regarding the ethical value, which we are concentrating on actually on that things. And for the leader healthcare leadership should be actually deeply qualified in quality services, and not only that, but also communication. And by the way, in a few months, I got a book regarding communication in healthcare. It will be published soon in maybe 2 or 3 months maximum, talking about all of these things. Yeah.
So now we are looking forward for your book to be published. So, where we can find your book, and please tell us to the audience who are watching you when it
Yeah.
will be published.
Uh, by the way, I will publish it actually on, you will find it on my LinkedIn as a data.
Okay.
So if you'll just go on LinkedIn, just tracking my name, I'll put it there. And by the way, I wouldn't actually put it as a business, because I will offer it for free for
Wow.
all academic institutions and leadership institutions. So the purpose, not a
That
business,
yeah.
it will be for free. Yeah.
That's a very good purpose you are doing it for. So, how can postgraduate medical training programs better integrate data literacy and digital competencies into the curriculum?
Yeah, this actually is a bit deep
Yeah.
question. Yeah. I'm the president of the Saudi Anesthesia Scientific Council. So me and my team, we are leading the postgraduate training and qualification in anesthesia. I'm also part of the training and examination in critical care also. So the it's the regarding how to involve all trainees and postgraduate trainees in these things. We started not to put it as an elective subject, but to put it as one of the core skills
Core skills.
for them. Yeah. And we involved that, we integrated that in the longitudinally in the curriculum itself. So we are training people in anesthesia and critical care, because they are part of the either perioperative medicine, and they are part of the emergency and disaster and CPR. So we involved them actually how to read the dashboard itself, how to do actually critical analysis, and to how to we involved them in our meetings, and part of it in the service management and leadership. We involved them in the quality risk management, and we actually involved them in the planning for the daycare surgery, for the involvement in the emergency departments, and so on. And also, last but not the least, is the auditing meeting, which is high leadership actually meeting. So we are preparing them from the beginning for that. Yes.
Yes, that's very important actually in the current dynamic, in the current landscape. Well, now, what are the key challenges in aligning clinical training with evolving healthcare technologies, and how can institutions overcome them?
Yeah. You know, it's the challenge is also from other common industry
Yeah.
challenges, talking about revolution in artificial intelligence, and also in data science in general. Nowadays, I want to tell you that nowadays some universities, they have faculties for to have bachelor degree in data science,
Okay.
and postgraduate in data science. So there is a revolution in technologies, and we have to keep up with them, otherwise we'll be lagging behind. This is one thing, and these actually will require robust faculty response and preparation, otherwise there will be gap in that things. Not only that, but also we are facing, because training in postgraduate, generally either surgical or medical, the curriculum is overloaded. In average, it is between 4 up to 6 years postgraduate after the College of Medicine. So there is a challenge that there will be curriculum overload for these things. Not only that, but also we are facing sometimes, and a lot of times, that there is resistance to change, especially from those who are not interested in that things. And not only these things, but very ethical and very deep point is the equity of the training. Everywhere centers, they are not equal in the infrastructure. So we are actually facing sometimes that this center is higher than the other center, and that's why we are preparing a program that there will be rotations for the postgraduate to go from center to center, to have the equity of the services, equity of training, and the exposure to different technology. Yeah.
Yeah. So, well, now you talked about how infrastructure is important, how data literacy is important, how data transformation in healthcare is important. Now, the last question from you is, looking ahead, how do you see the intersection of leadership, data science, and medical education shaping the future of healthcare delivery globally? I'm talking about on the global perspective.
Yes. This blend, as I told you earlier, of the leadership itself and preparation of leadership, which is a long journey, and to be competent in that, to be unique in that, it's a long journey, together with the data science, which is again a marvelous, a beautiful science, and together with the specialty in medical education. Nowadays, we have people, they have got PhD in medical education. Medical education is a different science itself. It's not actually clinical part. It is it's actually a knowledge itself. So having the blend of all of these things, leadership, clinical, actually advanced clinical skills, and the medical education. This needs governance of all of them altogether. So blending these things actually will need the capability and anticipatory care. It will need actually workforce development and staff development, and it will needs continuous development of the staff and trainee themselves. It will need, for example, that there will be distributed leadership. So, and delegation of leadership from place to place. Let me just tell you about one thing, and it will need actually personalized pathway um, uh, redistribution itself, so or redesigning of the pathways. uh, we got, for example, just to understand the idea, we got we are expanding in my specialty, for example, in all over the country, and main cities, and sometimes the other minor cities for the trainees in the beginning, and then they will come to the main city for more exposure. To overcome all of these things, we got a need for e-learning. And that's why we got an collaboration with the American Society of Anesthesia. They have a dashboard. We call it from our side ECAP, which is like a CAP, educational CAP. The trainee will go online every day. He will get educational material. He will get some quizzes to go through it. Narrative, educational material, audiovisual materials, and simulation based things. So and that's why they will it will fill the gap here and there. um, uh, for all of these things, by the way, to lead, I got a great team, by the way, to manage all of these things regarding the workshops, regarding the e-learning, regarding all of these things. And it is very tough and difficult, actually, job. That's why, as I told you earlier, that the leadership, these things need a preparation. I cannot bring a clinician and put him in front line to be leading like that. That's why I got a book which is published actually recently, also called Healthcare Management. It's talking about how to prepare a clinician to be a leader. Again, you will find it in LinkedIn, and also I'll offer it actually as a free copy, digital copy for all academic institutions. So it's not an easy stuff. It's not an easy journey. It needs long-term preparation. Yeah.
Definitely. So, how clinicians can be a leaders? You can find the book on your LinkedIn, Dr. Saleh.
Yes.
Yeah, so it's available for free for everyone. So all the clinicians or the leaders, the healthcare experts who want to be a leader, you can definitely refer to the book. Well, now as we are ending the podcast, so there are a lot of young individuals, young medicine students watching you, healthcare experts watching you. What advice you want to give them?
My advice for them that uh, education and clinical practice is long term. Myself, I got around 14 years of continuous education, so it's not an easy.
And it's
So
a never-ending
never
learning.
ending.
It's a
Yeah.
never-ending learning.
I'm still till I'm in the mid 50s right now,
Oh my
so
God.
I'm still learning. I'm still taking courses. I'm still actually continue to learn more and more, and just something to tell the audience that I'm preparing now even to study bachelor degree in law. So it's never ending. So dedication, ambition, hard working actually is the clue how to be distinguished among compared to others. Yeah.
Thank you so much, Dr. Saleh, for speaking with us. Well, what an inspiring and insightful session that was. Well, thank you so much to all the viewers for joining us till here and watching the video till here, well, please like, subscribe, and comment on the video. Thank you. We'll see you again in the next series.